to see that everything's going to go right. I know I'm live on YouTube at this point. However, all right. We'll give this about one more minute. I am super happy to be here, and we'll see how this goes, shall we? If you have any questions, go ahead and put them into the chat window. Oh, hey, friends. I turned around and there was icy eyeballs. Hello. Hello, everyone. Let me move my light up. Okay. Hi. We are at 2 o'clock. And we are going to be starting now. Hi, everybody. Thank you so much for hanging out with me. I am going to do a quick introduction about myself, and then I am going to start moving through these questions as they come up. So whatever you have, you can ask me. So yes, Doctor, I'm a veterinarian. I graduated from University of California, Davis in 2002 with, I tracked exclusively small animal, which means that I had very little time out in the barns. And I spent all of my time with cats and dogs. I have 16 years in private practice in both California and Colorado, where I specialized in both cats and dogs. And I have been retired from practice for 2 years. And instead, I do wonderful things like hang out with all of you. I'm so excited you're all here. Okay, so just as a reminder, this is for educational purposes only, my friends. I do not have a legal veterinarian client relationship with any of you, not that I know of yet, so I cannot legally give you advice. However, I can talk to you like you're a friend who's coming to me for some advice, right? So let's just say we're friends, and we'll just say that we're having a conversation and I'm sharing interesting information with you, okay? So if you have questions, put them in the chat window. I see a ton of questions popping up already. So thank you to everybody who's saying hi. Hi to Amy. Hi to Lillian. Hi from Dave. Hi, Kendra. Yeah, okay. Well, let's get into this, all right? Can 2 cats stay 3 days home alone? Wow, great question. Okay, so responsibly speaking, I should tell you, no, you should never leave animals alone for multiple days unsupervised because you never know what would happen to them. However, could 2 cats potentially survive with enough food, water, and clean litter boxes for 3 days? Heck yeah, they can. I mean, as long as they're healthy, right, and don't have any other kind of problems, such as medications that they need or things to that nature. But otherwise, cats are amazing. If they have enough square footage, it's generally like 300 square feet per cat is what is recommended as a minimum. But yeah, if you have enough food and you have enough water and you have enough clean litter boxes, and for 2 cats for 3 days, I would suggest probably 4 litter boxes all kind of set up together. Yeah, you can. Now, does that mean that you may not have disaster because there's nobody checking on them? Of course it does. Hello, we're all adults here, right? What I would recommend is having somebody that you trust, whether a family member or a friend or a service, check on the cats at least once a day. That way they can make sure that somebody is having their food and their water and their litter boxes, okay? So that's my answer to that. If you have any questions, let's see what other questions we have coming up here. How do you get rid of fleas on an adult cat? Great question. We are headed into flea season where people are going to start seeing these creeping critters popping up all over the place. Fleas are absolutely awful and awesome at the same time. I mean, if you think about it, they're this big and they can jump like this high, right? So fleas will hatch anytime that they're near a source of heat. that lets them know a blood meal is nearby. Me, cat, dog. So they'll hatch. Their eggs will hatch in response to heat, carbon dioxide that mammals are exhaling, or vibration. So that's why when people go into an abandoned house that has been abandoned for a while and they walk across the carpet and then a day later there's fleas everywhere. Well, the vibration from walking caused all the flea eggs that were hiding in the carpet to hatch. And then suddenly, boom, you have a flea problem. And female fleas can lay hundreds of eggs per day, and they take about 2 weeks to hatch. And then they hatch, they eat, they make more fleas. And so if you are seeing one adult flea on your cat, that may indicate that you have a bunch of other stages of fleas in your environment, because whenever you see one flea, you got to know that there's larvae, pupa, and eggs hanging out nearby, right? So if you have cats in your house and they're indoor only, then you shouldn't be getting new fleas. If you are getting fleas on indoor only cats, then there has got to be some sort of source of infestation, right? Either another animal that's coming in, maybe the dog, maybe you're bringing the stuff in on your clothing and not knowing, maybe it's hiding in your carpet or under your cushions, right? So there are tons of products out there, prescription products. There are over-the-counter products that kill fleas too, but I tend to tell my cat owners to not use those products on their cats, especially and this may sound bad, but like the Hearts products, they're cheap. Yeah, I get it. They're cheap, but the ingredients in them are not labeled for cats to be safe. And I'm talking about permethrins. Permethrins can cause a lot of toxicity. So you want to stay away from those over-the-counter flea products because they're mostly designed for dogs. They're safe in dogs. Cats don't metabolize them the same way, right? And I've seen a lot of toxicities with over-the-counter flea products. What you can get is prescription flea products from your vets. Vets have all different preferences on what they want to use. So take their advice into heart. And if there's something that works better for you, do not be hesitant to ask your veterinarian to get that for you. Okay. A lot of times we just go with whatever the vet has in the hospital. But if you really know that something else will be better for your cat, ask the vet to get that for you or buy it online, right? There are a ton of products out there. I like the isostasylines. I don't even know if I'm saying that right, but the things like Bravecto. Bravecto's topical. It lasts for weeks. It also gets mites. Amazing, right? So make sure that you are using a quick kill, long-lasting flea kill product on your cat if you are noticing fleas. The other thing to do is address your environment. Fleas, as I already said, love to hide in cracks, under cushions, in carpets, on bedding, in leaf litter, underneath patios. They like dark, cool places, and that's where they're going to go to hide and hatch and cause you problems. So if you are in a heavy flea area or you're dealing with constant reinfestation, then you have got to address not only killing the fleas on the cat, but also in the environment. And for this, it's going to be a bit of a pain. I'm not going to lie. And it may get worse before it gets better if you have a bad problem. But the best thing you can do, vacuum, 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 and then vacuum again. I would say vacuum every day for a week and then vacuum like every other day for another couple of weeks. And this includes vacuuming in and under your seat cushions, washing pet bedding, getting into cracks and crevices, getting your carpet vacuumed. Doing that will suck up eggs and pupa and larvae and even adult fleas in the environment. And it will continue to suck them up as they hatch because they're going to keep hatching and keep hatching and keep hatching. Sometimes it gets worse before it gets better because if you have a lot of fleas in your environment and then they hatch, now they're all around you. But those fleas are going to die off if you're using your good flea control product on the cat and making sure to address stuff in the environment as well. People often ask me about natural solutions for fleas as well. Sure, try it. I mean, the worstest thing is that it doesn't work, right? Diatomaceous earth is a powder that works really well if you sprinkle it, especially in cracks and crevices. If you sprinkle it under couch cushions, if you do sprinkle it on carpet, you kind of got to work it in. You got to work it in with your fingers, and then, rake it. I would even rake it. That dries out pupa and larvae, kills them, works really well, natural, totally safe. Some people will plant azalea bushes because those will repel a lot of not azalea bushes, I'm sorry. It's the ones that are the orange ones. Maybe you guys can help me out. They're the orange ones that people use in the gardens that keep the bugs away. Somebody, whoever is going to figure that out for me in the comment section, go for it. But again, if you have a bad flea infestation, it can take 2 to 3 weeks, even up to a month to get rid of it. So also start early. I have so much to say about this topic, as you can tell. Start early, start before it gets warm out. That way you keep those fleas out of your world, basically before they even start. The other thing about fleas that you should know is that they carry a couple of diseases that can make your cat sick. Tapeworms being a main one, right? Humans can get them also. And it's funny, the only way you can get tapeworms is by ingesting a dead flea that has a developing life stage of tapeworm in it. Isn't that gross, right? So if you have tapeworms, that means at some point, well, we're not going to talk about that. But these are all things that you can do to help you be able to keep fleas out of your environment. Oh my goodness gracious. Okay, so we have Kaylee. Hi, Kaylee. This is perfect timing. I just adopted an FIV positive cat. Well, congratulations, and what a big heart. Great job. FIV positive, for you guys that don't know, is feline immunodeficiency virus. It's just like HIV in humans. It's a virus that is usually spread between cats by fighting. It's a bloodborne disease. And so that's typically how it is spread. And it's mostly seen in male cats that haven't been neutered, actually, because they're the ones that are out there fighting. And it does affect the immune system in such a way to make these animals more vulnerable to infection, right? They are immunosuppressed. So the question is, do you have any recommendations on how to support or boost his immune system? Well, some people have success with supplementing their cat with lysine, which is just a natural supplement that they can use to boost their cat's immune system, right? And so it comes in all different versions. There are chews, there are powders, there are several different brands out there. Viralice by Vetquinol makes one. VetraScience makes one. I would just go to Chewy and type in lysine. And basically it's an immune supplement for cats that can help boost their immune system. Another thing that you can do for this cat, obviously you've probably already heard this from your vet, but keep this cat indoors. And that's not only to protect this cat from whatever infections that are out there. Wow, this sounds like COVID-19. Whoa, okay. But it's also to protect other cats from your cat, right? Because that's how it's spread from cat to cat to cat, usually through bites. So lysine. Great option. Another thing, probiotics. You guys may not know this, but our bodies and our cats' bodies are actually more bacterial cells than human cells or cat cells. Isn't that crazy? And they know now that the gut, which houses all of the bacteria, right? And they call that your microbiome, is vastly responsible for your mood, your health, your immune system. They now know that your largest immune system is actually in your gut, right? Your gut has not only an immune system, it also has a brain, which is very interesting, but we won't talk about that. So another way you can boost this cat's immune system is probiotics, probiotic supplementation. All that does is continue to supplement that cat with good bacteria, right? We want to make sure this cat has the correct microbiome to best support this cat's health. And then a third thing you can do is just make sure that this cat is at an optimum weight and eating high quality nutrition, right? Nutrition, big topic. Don't know if I want to dive too much into it, but you are what you eat. And if you have a weakened immune system, then you need to feed that immune system with the best nutrients possible. So get this cat on a high quality, highly digestible, low grain diet. Okay. And we're not going to talk about grain free. We're not going to talk about all of that, but this cat needs protein. This cat needs protein to not only to build muscle, but for energy and for immune support. And I would also recommend, if you can, make sure that you keep this cat on a combination of wet and dry food if the cat will eat both. And then make sure that if you see any signs of infection in this cat, fever, loss of energy, signs of skin infection, red skin, respiratory infection, runny eyes or sneezing nose, diarrhea, vomiting. If you see any of those, get them addressed immediately because your cat doesn't have the resources necessary to overcome the infection on their own. Another big thing I see in these guys, dental disease. We want to make sure to have their teeth addressed on a regular basis so that they don't have the additional stress on their system of having dental infections, okay? So I feel like I've said a lot about that. Let's move on. So there was another question in here about best flea treatment and prevention. I guess fleas are on all of your minds, my friends. So I'm not going to go back into that because I did talk about it a lot, but I do like the new long-lasting products like Bravecto and Simparica, and I think there's another one out there. But they seem to be pretty safe in cats. They also eradicate mite infestations, which is amazing for ear mites. I don't know if you've ever had a cat with ear mites. They last a long time, and they just do a really great job. So those are the ones that I like. Also, do not forget to address your environment. I know I went on and on about that earlier. So let's see. Dave Stelling just adopted 2 brothers, 12-week-old tabbies. So you're a new proud parent. Congratulations. I love that for you. How do you get rid of fleas and ticks? Goodness, I'm glad I went on about fleas and ticks for a long time at the beginning of this because you guys have a lot of questions. Holy cow. Okay, let's see what else. This one's awesome. I have 4 cats. God bless you. The oldest is 9 and all the younger ones kind of pester her. Any suggestions to make things easier to get them to leave my oldest alone? Great question. So yes, cats have different personalities just like humans. Some of them are extroverts, some of them are introverts and don't like to be pestered. Sometimes cats don't want to be pestered because they just don't feel very well. And in older cats, especially around age 9, you want to make sure that that cat isn't suffering any kind of chronic pain from osteoarthritis, which we didn't, as vets, used to diagnose in cats because we just didn't recognize the signs. But now we know that most older cats have some level of osteoarthritis. And if they don't want to play as much or jump as much or maybe they're sleeping more, those are all signs that they just don't feel very good. So make sure your cat is feeling good. Secondly, make sure each of the cats, you have 4 of them, make sure each of your cats have a place that they can retreat to where they can be left alone by other pets and people. And so that means that you need to have enough cat trees for all of them. You need to have enough food and water bowls for each of them. They each need to have their own resources. They each need to have their own litter box. I know, this sounds like a pain, but if you were my patient, this is what I would tell you. And they also need to have their own, toys. Now, cats will share toys and they'll drink from each other's water bowls and things like that. But you want to make sure that you don't create any kind of sense of competition between the animals because that will escalate conflict. So make sure you have enough resources for each and that they're separate enough so that they can get away from each other. Another thing you can do for older cats is make sure you have enough vertical space. And I'm talking about shelves, top of the fridge, any way that you can increase vertical space in your home will be a good way to help that cat be able to get away from the other cats. Okay, so make sure you have enough resources, enough space, vertical space, really important. Next, you want to make sure the other 3 who seem to really want to play with the old one have enough playtime and they get their energy out and their willies, right? So you want to make sure to have active playtime with these guys. Make sure you're engaging them. Make sure that they are having enough energy taken out of them by exercise so that they don't have to go take it out on the old lady, right? Or the old man. Old lady. It's an old lady. And then let's see. If none of that's working, then you may just need to have your old lady have some timeout time each day. Maybe you have a room that you can close the door and she can go in there and be by herself for an hour or so, if that works. But again, don't force them to get along because they may never, ever get along. Make all of their interactions together positive. Make sure that you're giving treats to everybody and make sure that you have the resources and see if that helps. And then if you're still having problems, talk to your local veterinarian, because that person has lots of answers for you. Okay, hold on. Let me take this one down. All right, next question. Hello, should all cats be eating soft and dry food? Well, thank you, Santa Claus. That is a very good question. Should all cats be eating soft and dry food? No, I'm not a big believer in global statements. And I know when I used to say it has to be all one way or all another or never, that half the time I was proved wrong. So cats are born with very specific food preferences. I don't know if you've ever tried to switch a cat's food, but some cats just will not switch food. And it's taste, but it's also really texture. I have found some cats that if you change their star-shaped food to a triangle food, that they'll stop eating it, even if it's the same flavor, because they don't like the texture or the shape. They don't like the way it feels in their mouth. So can you offer cats different foods? Yes. Are they naturally going to eat everything that you put in front of them? Heck no. Heck no. They're not going to do that. Should you offer them all dry and wet food to start to see if they will? Absolutely. Should you start offering dry and canned food when they're very little? Absolutely, yes. Yes, yes, yes. I am a huge believer in a combination of canned and dry food if you can get your cat to do it. And let me tell you the reason why. Dry food is very high in calories and often very high in carbohydrates. It can't be any other way. In order to make those little kibble shapes, you have to have carbs to cook to stick it all together. You have to have the carbs, right? It doesn't matter what kind of carbs, whether they're wheat and corn or what else are they doing out there? Oats and rice or whatever other carb that they're putting out there. It's a carb, right? Canned food, on the other hand, is mostly meat. It's mostly protein and water. Protein and water are incredibly important for cats. The reason being is they are obligate carnivores. They must eat meat, not only to build muscles, but to burn it for energy. They also are desert animals, and they don't have a strong thirst drive. They are different than humans. They are different than dogs. They don't feel thirst the way we do. They don't go to seek to drink water the way we do. And so henceforth, they are often dehydrated if they get any kind of sickness. If you're feeding them canned food, they're getting protein and moisture. Great. And when I look at canned food, the least amount of ingredients is what I'm looking for, right? And ingredients that you can recognize. I mean, I've looked at ingredients labels and the words are like that long. I mean, it's crazy, right? No, you want meat, water, maybe some wheatgrass in there, and that's about it. And then feed your cat a combination of both. You can leave the dry food out during the day so they can snack a little bit if they want. And then the canned food can be a special treat twice a day or something like that. Okay? There's pâtés, there's stews, there's chunky, there's so many different options out there. But yeah, if you can feed both canned and dry food, that's the best. That would make this veterinarian very happy. Okay? What is my, Scarlett, hello, my friend. What is my favorite kind of cat breed? I don't think I have one. I just love cats. I love cats. I have met the most amazing mixed breed Heinz 57 cats that have no pedigree whatsoever. And then I have met the most princessy ragdoll show queens that you've ever seen, and I love them all. So if you absolutely made me drill, I don't know. Maine Coon cats are awesome, right? They're like giant dogs. Okay. So here's another question about immune boosting in cats with infectious disease. So we addressed the cat with FIV earlier, which is feline infectious or immunodeficiency virus. It's like HIV. Now this question is there anything to do to prolong the life of my FELV positive cat? Okay, so FELV is another infectious disease in cats, very common. It's feline leukemia virus. Okay, and it's called leukemia because it often affects the blood cells. And what it does is it decreases the blood cells, especially the white blood cells, but eventually it impacts all blood cells. And that again affects the cat's immune system and makes it harder for them to fight things off. So I hope you were watching when I was talking earlier about the FELV+cat, lysine supplements, a good probiotic to support the microbiome, the gut health, right? The gut bacteria, and then a very high quality diet of both canned and dry if you can. And then making sure to keep that cat indoors at all time because that FELV is also very infectious, feline leukemia virus. And in contrast to FIV, which is passed by usually cats biting each other, FELV is called the loving disease because it's passed by cats being nose to nose. So you want to keep that cat indoors and keep it at one cat only household if you can, okay? Or have multiple cats with the same infectious disease. You can do that too. Lastly, get any infections addressed right away and make sure to keep up on any dental care because I see a lot of dental disease in these FELV cats. They can't fight off dental infections just as well. We're thinking of starting them, I assume you mean a cat, on the probiotics. Your thoughts, please. Well, I think probiotics are great. I mean, you guys can probably tell that already. So I would say, yes, probiotics. We are just now tapping the wealth of knowledge about the gut microbiome. I said this earlier, but your body and my body and your cat's body has more bacterial cells than human cells. And so you want to make sure that it's the right bacteria because bacteria they affect your mood, they affect obviously your gut health, they affect your skin health, your hair health, your immune system, your heart, everything. Right? So you want to make sure that your cat is carrying around the right bacteria in its guts. And one way to do that is with a high quality probiotic. In fact, probiotics are so important. There's a lot of research, especially in Israel, going on about probiotics. But most foods, good high quality foods, are incorporating probiotic into the food itself. They also incorporate something called prebiotics. Prebiotics are not probiotics. Prebiotics are carbohydrates that feed the intestinal cells, right? They feed the intestinal cells. They feed everything that's going on in the gut so that the gut itself can work well. So you want to look for a food that has both prebiotics and probiotics. Pre, P-R-E, and pro, P-R-O, okay? Should you do probiotics on top of it? You can. I mean, if you have a cat that has a sensitive stomach and maybe, vomits once a week or has loose stool on a semi-regular basis, you may want to start some probiotics and see if it helps. One of the most common ones, there's several brands out there. Fortiflora is one. It just is a powder that you just sprinkle it on the food. If your cat is on any antibiotics, you want to make sure to give probiotics at least an hour away from when you give antibiotics. Because if you think about it, the antibiotic is going to kill the probiotic. So you want to keep those separate. But lots of great brands out there. You don't want to use the human probiotics on cats, by the way, because we have different strains of bacteria in our guts. Okay, so you don't want to just go out there and get some yogurt or bacillus or whatever human probiotic. You want it to be a cat-specific strain. And they're finding out more and more research about these different bacterial strains that are in our guts that keep us healthy and keep us alive. As a side note, I think it's very interesting to see how the high use of hand sanitizer may actually be killing off these really important bacterial cells that make up our bodies, but that's for another conversation again. Okay, next question. Oh my goodness gracious, this one's a big one. Just had a cat diagnosed with FIP. My friend, I am so sorry for you. Roxanne, my friend. So the question is it worth treating with GS4415247? That is a great question. So I'm going to talk a little bit about, what FIP is, and I am also going to be looking up this new nucleotide. Oh my goodness gracious. So this research was done by my old professor actually at Davis. And I'm just reading through an abstract right now. So feline infectious peritonitis, my friends. If you guys are not familiar with the disease, it's called FIP in short. And it is a very common, it's not very common. Oh my God, I can't believe we're going to talk about a coronavirus. Here we go. Okay. All right. So if you didn't know already, my friends, there are coronaviruses in almost every single species of mammals on the planet. And in fact, they're in other species as well. They're in birds. I mean, you name it, the species has got a coronavirus. Cats have a coronavirus as well. So do dogs. They've had them all along. We never freaked out about them before. But what happens in some cats that have exposure to a feline coronavirus, okay, this is not COVID-19, not the same thing at all. It's a different strain. Some cats, not very many, but a few, will have what's called a malignant transformation of this virus in their system. So 99% of the cats out there exposed to their version of coronavirus, just like people, never have any problems whatsoever. In fact, it's so common we don't even vaccinate for it in veterinary medicine. But on the rare occasion, there's something in a cat's system, and we're not sure quite yet what it is, it's frustrating, will cause this virus to turn bad, for lack of a better way to say it, and it develops into a condition called feline infectious peritonitis, FIP. There's a dry form, there's a wet form, it doesn't matter, they're both fatal. There is no treatment for it until now, right? And any treatment that we're developing is still very experimental, right? So the question is, should they seek out this additional treatment? Let me get it again. So GS4415247, okay? So basically, they have a little precursor to another molecule. This is very, very, very much like the COVID vaccine in humans. It's mRNA technology, right? And so the question is it worth it? Well, I would say that is a very personal choice. And I have not had experience with this treatment yet. It has not reached the general public of veterinarians. But if your choice is this disease is 100% fatal, your cat will die, or to try something that's new and may or may not work and it might give you a chance with your cat, I don't know. You have to think about it that way. Are you going to spend money and your cat might still die? That is always a possibility. But you also have a chance your cat might survive. So you have to make that choice. And I do not have enough exposure or work with this particular analog yet to advise you one way or the other. But I would definitely tell you to keep doing your research and look into it for your cat, okay? Okay. This person has a question. Who do we have here? Debbie. Debbie wants to know if she should give a lysine supplement who makes wheezing sounds, wheezing hair. I have never seen hair that wheezes. I would like to. But okay, let's go there. All types of noises, funky black eye discharge. Ew, gross. Okay, so it's important to make sure that you are able to understand the cause of why your cat has those conditions. If it is due to a suppressed immune system, lysine could definitely help. Lysine does not help in all cases. For some cats, Boom, they never have any problems ever again. Other cats, their owners will just give it to them when it seems like they're having some sort of respiratory flare-up. Other cats, it doesn't make any difference at all. So it's a fairly cheap, very safe supplement. I would say it's worth it to try and see if you cannot get some of those symptoms to reduce a little bit. Okay. Amy Rogers, hello, my friend. How do I get my 13-year-old cat to stop over-grooming? Big question. Well, so there's a lot of reasons why cats will groom more than they should. Some of them are behavioral. Some of them are medical. So cats can overgroom because, and a 13-year-old cat, I don't know if your cat is indoors only. I don't know if your cat has any other concurrent medical diseases. Cats can overgroom because they're stressed because of something. And it's sometimes really hard to find out what is stressing those cats out, right? You just don't know. You're like, I don't know what's stressing my cats out. But one of the things that will cause cats to stress out, groom too much, is stress. So if you have other cats in the household that are, bullying your 13-year-old cat, I don't know. If you have visitors, if you have done renovations, if you have been stressed yourself. So our dogs and our cats can definitely pick up on our emotional stress. And there's been so many times where I have seen cats for some sort of stress anxiety disorder. Either they're peeing outside the litter box, or they're pulling all their hair out, or they're becoming aggressive. And what is interesting is they have picked up on their owner's stress and then manifested as their own kind of stress response themselves. So make sure you're checking in with yourself and making sure you're managing your stress as well. Pain from any kind of condition can make cats stressed, and then that stress can result in over-grooming. So a 13-year-old cat, you may have some osteoarthritis going on underneath. I don't know. I haven't seen your cat. But make sure that your cat isn't over-grooming because they're stressed out due to pain from something. Also, if you haven't had your cat checked out, it's a good time to have your cat checked out. Have an examination by a vet. Get some blood work run, right? How are those kidneys doing? How is that thyroid doing? A 13-year-old cat may be struggling with hyperthyroidism. Hyperthyroidism is a common endocrine disorder in older kitties where their thyroid gland, it's right here, just like in us, gets enlarged and makes too much thyroid hormone. And then they can get crazy. They are yowling, they're eating, they're losing weight, they're pulling their hair out. Could be hyperthyroidism. So I would definitely say get a blood panel checked if you haven't had one yet. If you, the other things that can cause them to overgroom, barbering is what we call it. Allergies, infectious skin diseases, right? So allergies, flea allergy, we talked about that already, can cause cats to get very itchy, and they get bumps all over their skin called miliary dermatitis. Food allergy. The most common allergies in cats are beef, chicken, pork, soy. It's your main proteins. So food allergies can cause cats to overgroom. Seasonal allergies can cause cats to overgroom. Ringworm infestations, skin mite. I mean, the list goes on, right? So make sure that your cat isn't dealing with some sort of medical condition. Very important. If you've done all that and you're back down to behavior, well, maybe it's just time to talk with your veterinarian about some Prozac. And you laugh at me, but I have put a lot of animals on Prozac because they can have chemical imbalances in their brain just like we do. And so maybe starting a short-term anxiolytic or an antidepressant or something like that will help get your cat calm enough to where you can start working with your cat and get different things in place so your cat doesn't feel so stressed and doesn't start to pull all the hair out again. Hopefully some of that's helpful. I know this is a big question, right? But make sure there's not an underlying medical condition. Okay, so, oh my goodness gracious. We've got a, this is from Jenny. Hello. Why does my cat take a bite out of food? Then the next day when I give her the same food, she suddenly doesn't eat it. It's really annoying. We need to open like 3 different flavors a day. I could definitely see that would be frustrating. And it seems like you are I'm not sure if you're doing canned or if you're doing dry, but again, Jenny, big question. And cats don't do this per se to piss us off. They're not trying to get even or whatever. They don't have the same kind of cognitive abilities, I would say, that we have. They have different ones. So why is the cat doing that? I don't know. I would say it's important to make sure that cat has a physical examination, that there isn't, again, something medical, right? I mean, your cat could be dealing with something that makes her feel nauseous. She could be dealing with hairballs. I don't know, right? She could have a sensitivity to ingredients in the food that make her feel nauseous. And so when you go to give her the food again, she's just like, no, I'm good, thank you, right? So you need to make sure that it's not something that the cat is reacting to within the food or a medical condition that the cat has. Also, if you have other cats or animals or kids, make sure that wherever the cat is eating, it's quiet, right? Not a high traffic area. Cats can get really spooked easily when they're eating because they feel vulnerable, right? They have their head down. And if you remember in the wild, cats are prey animals as well as predators. So they always have to be looking around, right? So if your cat's stressed at all, that could definitely affect appetite as well. So make sure there's not a medical condition that's affecting the cat. Also, I would talk to your veterinarian about maybe starting a diet that is easy to digest. The other thing is making sure that your cat can breathe correctly. Cats can get stuffy noses because they get upper respiratory infections, and that can impact their ability to smell. And so then they won't want to eat because they can't smell. So make sure your cat can smell correctly as well. And yeah, check for stressful things. And then maybe next month when I do this again, you can give me an update. Okay. Okay. Hold on. How many Okay, here's one. Oh, here it goes. How many babies can a cat have? Well, my friends, so many. So many cats. There's really no limit to the number of kittens a cat can have. So cats are what are called induced ovulators. They will go into heat and they will stay in heat until they get pregnant. And if anybody's ever had a cat in heat, you will understand and know that these cats have very specific behavior that they exhibit when they are in heat that will attract potential cats to come and mate with them. So a cat can start having kittens when that cat is still basically a kitten herself at about 6 months of age. And she can get pregnant every 3 months. And every litter can have anywhere from 5 to 10 to more kittens in it. So you do the math, right? It can be a lot of kittens really quick. And I've seen people who are like, well, we know that we want to get her spayed, but she's pregnant and we just want her to have the kittens and then we'll have her spayed. And I'm like, okay, no problem. Just make sure that you keep her inside until I see her for her spay or she's going to get pregnant again. And she got pregnant again. So you have to keep those intact female cats indoors. And I would suggest getting them spayed as soon as possible. I generally will spay cats anywhere. I'll spay them as early as 6 months. I have done it younger when I worked for shelters, but I'll generally do around 6 months to a year. About that is right. So lots and lots of babies. Okay. Okay. More questions. Here we go. Hold on. Okay. Oh no. Let's do this one. This one will be a hard one. What's our time? Okay, we're doing okay. So this one is from Flavia? That is a great name, by the way. Our 10-month-old rescue cat went back to peeing on the dog's bed even after being neutered. He sprayed before getting fixed, but now it seems he's actually using it as a litter box. Oh gosh. Okay, and then this goes on further. I think there's more to this story, so hold on. Okay. There was more to this story, but now I can't access it in the chat. Okay, well, let's talk about this. Okay, peeing, oh. So this is a big problem. You're not alone. I would say that a lot of my clients used to have this particular issue with their cats, where they stop using their litter box and they start using something else. And it can get really, really hard to get them to stop it once they've formed that habit in their mind, right? So a couple of things. It would be good to know whether this cat uses the litter box at all to urinate and defecate. Because if the cat's not using the litter box at all, then there's something about the litter box or the litter that the cat doesn't like, and something about the dog's bed that the cat prefers. So make sure that the cat is using the litter box correctly. Secondly, make sure that the cat is supervised as much as possible when around the dog's bed. I know that can be almost impossible. One other thing you can try doing is, I have actually had people take the litter. So the cat is going in one particular place, right? So they take the litter box to wherever it is and they set it down there. So setting the litter box in the dog's bed. Maybe you need to put more than one litter box if it's a big bed, right? But the idea is, hey, the box is here, and then see what the cat does. Does the cat like go into the box? Does the cat go around the box? If the cat starts using the box because it's on the bed, then you can start to walk that litter box slowly, day by day, back to where you want it to go, so that the cat doesn't see that you're actually moving that litter box. If you are moving the litter box day by day and the cat is doing great, but then suddenly goes back to the dog's bed, you're going to have to go back to square one. Make sure, so are there other cats in the household? It's also, are there any stray cats in the neighborhood? If there's any extra animals in the neighborhood, that can be, especially stray male cats, that can be really stressful for indoor cats, and then they will spray or urinate in response to seeing or hearing or smelling that animal. So it sounds like still not spraying. It's just, the other thing, make sure your cat has a litter box just for him. The standard recommendation from behaviorists is you have to have one more litter box than you have cats. So if you have one litter box, then you have, or if you have one cat, then you have two litter boxes. Make sense? Okay. The other thing, make sure that you're not putting that litter box in a high traffic area, or a lot of people will put the litter box down in next to like the furnace or the boiler room or something like that. And I have found that cats, they don't like the sound. They don't like that big machine next to them. And sometimes they will manifest their displeasure by urinating on something that you have. Also, see if it's during a certain time of day. Is it random? Is it only at night? Is it in response to after the dog lays there? You're going to have to do a little detective work to understand what's going on with your kiddo, your fur kiddo, to actually start addressing the behavior, okay? So definitely not normal, Flavia, not sure how to say your beautiful name, and definitely worth a chat with your local veterinarian about more strategies. Another thing you can try is utilizing Feel Away. Feel Away is a spray. It's a feline pheromone spray that is designed to help cats feel happy and safe and secure. It's the same hormone that mama cats release to their kittens when they're nursing. So it comes in a spray, it comes in wipes, it comes in a diffuser, comes in all different ways. Maybe spray that around the litter box to try and entice your cat to use the litter box. Also, make sure your cat likes the type of litter. Some people change the litter to clumping litter. They don't like it. Then they have to go back. These cats, they're very specific situations, right? Okay. How to get rid of chin acne on an 11-month-old white female kitten. Oh my goodness gracious. Thank you, the Light of the Jedi, for your question. So it depends on what you've tried already. If it's just mild, so a couple of things. Make sure that you are not using a plastic dish for water or for food. Some cats can have a contact reaction to plastics that results in chin acne. And chin acne looks exactly like it sounds. It looks like pimples and pustules and blackheads and red skin all on the chin of a cat. So take away plastics. Make sure you using stainless steel is the best that's recommended, or ceramic. Make sure that the bowls are being washed I would wash them. If I were you, I'd throw them in the dishwasher every other day, because any of the bacteria that is on the surface of the bowl is going to transmit to the skin. And any cat that has chin acne already has a damaged skin barrier on their chin. So you want to reduce the amount of bacteria. And one way by doing that is washing the bowls every other day. Next, you want to use antibacterial wipes on the chin. And you can either get prescription from your vet, great, or you could go down to the local Walgreens, pick up a pack of Stridex pads, just normal acne pads, and then wipe the chin twice a day until all of the infection has gone away. That is the standard recommendation. For serious deep infections, we do start them on antibiotics, generally amoxicillin. But 9 times out of 10, you can clear it up. Now, if it doesn't clear up with what I'm telling you to do, then there could be a possibility of a food sensitivity, in which case you need to talk to your veterinarian about a food trial, which generally lasts anywhere from 6 to 10 weeks to determine if it's something in the food that is causing the symptoms. Okay, so those are my standard recommendations. Stridex pads, or even generic acne pads, they work great. You can use the human ones. If you don't want to do that, you could utilize some antibacterial soap. But when I think about soap and cats together, I would go with the wipes. It's a lot more easy. Okay. All right. Hold on. Oh no. Okay. Here's a question from Tim. Hi, Tim. Asthma, ? Do cats have it? My 4-year-old male cat appears to have respiratory events 3 to 4 times a week. Looks like he's coughing up a hairball, but nothing comes up. When should I be concerned? Great question. Well, I would say that it's never a time to panic, but it is not normal for cats to cough like that. And a cat that is coughing like that definitely has something going on somewhere in the respiratory system that needs to be addressed. So asthma can definitely cause respiratory difficulty in cats. It doesn't tend to cause coughing quite so much. It tends to be more that they're just having difficulty breathing and they look very pale or their gums look blue, but it can cause coughing as well. There are also several different types of infectious diseases that can potentiate bronchitis and asthma in cats, or pneumonia. Cats can get pneumonia as well. Even worms can cause these kind of symptoms in cats. So intestinal worms, such as whipworms or roundworms or hookworms, sometimes they can migrate right into the lungs and cause problems there. Another cause of coughing in cats that should definitely not be ignored ever is heartworm disease. We tend to not think about heartworms in cats because they don't tend to have it as much as in dogs, and we just haven't talked about it very much. But we really should, because a big dog could have heartworms, could have like 2 or 3 heartworms and still act fairly normal. Where a cat, where their heart is much smaller, even one worm can cause significant issues. So making sure that it's not an infectious disease. I would recommend, if this was my patient, I would do an examination and then I would take some x-rays and I would see, what are we dealing with? Are we dealing with asthma? Are we dealing with bronchitis? Are we dealing with worms? Are we dealing with pneumonia? What are we dealing with? And then after that, once I have a diagnosis, then I would start to treat them. Feline asthma, it really ranges in severity, just like in humans. Some people can have very mild asthma, where what you see more in cats, more than coughing, what you hear is wheezing, right? And sometimes they'll just sit here on their little legs and just, and it'll be hard for them to breathe, and you'll hear wheezing. So feline asthma can be caused by many different things, many different allergens. And in cats, oftentimes we will prescribe steroids to reduce the inflammation. We can do oral steroids. We can do injectable steroids. You can actually do inhaled steroids now, just like they do for asthma in humans. So there are options out there. If your cat is coughing like this on a fairly frequent basis, even 3 times a week, it's still worth an x-ray. So I would get an x-ray if that was my cat. Okay. All right. Let's see here. What do we got? Let's take this one out. New messages. Okay. Give me a second. Do they fight for food? Oh my gosh, so many questions, my friends. Which is the next one that I do? Oh, and it seems like you guys are helping each other. Oh, yes. Yes, I can talk about this. Hello, my friend Tina. Tina wants me to talk about vaccine schedules for kittens all the way to adulthood. Great question. Okay, so vaccines in kittens. Generally speaking, there is some variation on this because every vet is different. Generally speaking, we start vaccines when they're 6 to 8 weeks old, depending on the first time that we see them. And then we continue vaccines every 2 to 4 weeks, again, depending on the vet, all the way till 16 weeks of age. And in that time, they may get 3 boosters of vaccines, or they might get 4, right? At the bare minimum, they have to have 2. 2 is what we do in older cats. And the reason for that is the first vaccine kind of wakes up the immune system and lets it know what we're exposing it to. And then the second vaccine boosts that antibody response, right? So it's called a booster for a reason. The reason why we do 3 to 4 in kittens is because of maternal antibodies. Kittens, when they are born and they are nursed, receive maternal antibodies through the mother's milk, which is great for protecting them from infection, but not so good when you go to vaccinate because it actually wipes out anything that the vaccine does. The problem is we don't know when maternal antibody wears off. In cats, dogs, humans, it's hard to tell, right? It's different for every single individual. And so we have to give multiple vaccines over a set amount of period to make sure that those vaccines are actually going to work. The reason why we start them so early is because we do see a lot of infectious disease in very young dogs. And the main ones I'm thinking about are distemper and parvo. We see a lot of those. We see a lot of parvo, especially when it starts to get warmer. And in cats, cats get parvo as well. It's just called feline panleukopenia. It's just got a different name, right? So we vaccinate them against these viruses. And it generally, when I would see a cat, if I saw an 8-week-old kitten, I would vaccinate that kitten at 8 weeks, then at 12 weeks, and then at 16 weeks. That's just me in my own private practice. At 16 weeks of age, they receive a rabies vaccine. Rabies vaccine is different than the rest of the vaccine because it's a killed virus. You only need 1. We already know the maternal antibodies out of the way. You just need 1. Then in adulthood, at 1 year of age, we repeat all the boosters, including the rabies vaccine. And then me personally, I go to every 3 years in vaccinating. Some vets out there still are doing every 1 year. I mean, everybody's different, right? But I go to 3-year on my vaccines. And then with older cats or cats that have very low exposure limits, then we start to talk about, what do we need to be vaccinating your cat against? Because again, vaccination needs to be a very personal choice. It's interesting that I'm talking about this right now, but it needs to be a personal choice. And not every cat needs every vaccine that's out there. For example, there are core vaccines, rabies, distemper, panleukopenia. Those are all really common, rhinotracheitis, very common, what we call core vaccines. They are recommended for every cat regardless. Then there are things called lifestyle vaccines. Lifestyle vaccines are things like the feline leukemia virus vaccine. I always would have clients come and ask me, what should I do? Should I get the leukemia vaccine? And I'd say, well, do you ever plan to have your cat go outside? And they say, yes. And then I say, well, you should probably at least get it to start. And then you can reevaluate as you go along. But things like leukemia virus is a lifestyle vaccine. There used to be an FIP vaccine, which did not work at all. And so they discontinued it, but that was also a lifestyle vaccine. There was a Giardia vaccine, lifestyle vaccine. In dogs have lifestyle vaccines like lepto or Lyme or rattlesnake, right? So in general, that vaccine series, it's 3 to 4 vaccine shots visits when they're a kitten, at 1 year of age, and then every 3 years after that. Okay? All right. What are we going to talk about next? I am going to do one more. Okay? So we got Cynthia. Cynthia, why does my cat yowl loudly after using the restroom? I check his litter and I don't notice any blood. He is strictly on a wet food diet. Oh, goodness, I'm so sorry. So it sounds to me, cats don't do that normally. That's just not a normal thing. So it could be that something is causing your cat to be painful when he goes to the bathroom. It could be urination, or it could be defecation. Cats get constipated. They can get obstipated, where they can't pass anything and they have to have enemas, right? These cats can develop pain associated with the litter box. As far as urination goes, yes, bloody urine is a sign of a urinary tract infection or inflammation of the bladder, but sometimes the urine can look normal and still have blood or infection or other things in it. So if this is a new behavior and you haven't had your cat checked out since you've had this behavior start, call your vet and explain the situation. Most vets I know still aren't seeing people in their hospital, and so I totally get it if you don't want to take your cat in, but maybe you could bring a urine sample, a fresh urine sample to your cat, or to your vet, a fresh urine and fecal sample to your vet and have them check it out. Because that's not a normal behavior, and so that's probably indicative that something's uncomfy somewhere, and we need to do just a little bit more research on it. Okay? All right. So my friends, there are so many questions here, but my hour is up, and there's so many good questions. I see this one about dental disease, gingivitis, and stomatitis. Thank you so much. We've got Siamese kittens that they're getting. Oh my goodness. So a lot of questions about food. I'm going to talk about food more next time. I'll try to address more food questions. In general, I'm going to tell you one thing. You want to make sure that any food that you're feeding is AAFCO, AAFCO. That's American Association of Feed Control Officials. Make sure that it says on the label on the back that it says that this food is complete and balanced to AAFCO standards. Doesn't matter if it's done by feeding trials or by formulated. I'm not even going to go there. It just needs to say complete and balanced, because some of the foods out there are not complete and balanced, and they're designed to be used as toppers. And if you do not feed your cat correctly, then your cat's going to be at risk for malnutrition, especially with amino acids, because they have very specific amino acid profile requirements. So most canned foods out there are great. All right. Make sure it says real ingredients on the ingredient label, and also that it is to AAFCO. It is complete and balanced to AAFCO standards. Okay. We'll talk more about nutrition next time. But for the moment, my friends, this hour went so fast, and you have so many more questions, and I'm so happy to be able to help you in any way. So in order to help you guys, I want to answer your questions. So what you need to do is you need to go to All About Cats, and you need to go to the forum and go to the healthcare section, or whichever section you want, and leave me questions there. And you can even say, this question is for Dr. Wooten, because I am going to be moderating that forum. I'm going to be answering questions in the All About Cats forum. And so I know there are so many here that I didn't get to today, but if you head on over there and you ask me the questions, I will do my very best to answer your questions. So I am so grateful. Thank you so much for your time. And I hope to see you again next month when we do this again. All right? Mwah, mwah. Goodbye, everybody.